What I will first say is it's getting access to high level care immediately. And that's right. That's, I think, for us caregivers that enter the field of medicine for a reason. That's what we're here for. We just want to take care of people and we just want to get them the best care that they can get as soon as possible. So obviously that's a factor. I think it's the most important factor. And then I'll say very, very close second factor is the other people. Our patients are people and the people are at the center of our product. That also includes the providers. So the other half of the people. So we see huge provider satisfaction because they're safer, they're able to work from home. We think of how many providers are getting, I hate to say burnt out, but just at the end of maybe a limit, or maybe they just need a break from the traditional standard shift. So how great is it if maybe your pregnant provider or later in age provider, they have all of this knowledge. There's no reason for them to not work, but in traditional ER settings, there is no such thing as light duty. Well, remote provision of care allows for what we would otherwise call light duty work, and they can still use their brain and still use their knowledge and their experience to care for patients. So that's obviously a huge benefit to our care providers. And then even the bedside staff themselves, I can't tell you how much better I feel knowing my patient is taken care of if I'm that ER triage nurse, if I'm that ER manager and I'm watching the wait time go from 2 hours to 4 hours to 8 hours. If I can at least have some peace of mind to know that, okay, all of my patients are getting seen and assessed, I can sleep at night. Otherwise, truly, legitimately, these are the things that keep us awake at night. So obviously, patient satisfaction goes up, clinician satisfaction goes up, but Reed, you and I both know that's not the way the world works. We don't get to just say, hey, everyone's happy and that's all there is. But I am happy to report that, we have value models within eVisit and we have some really great data scientists that are able to pull records. And what we wind up seeing is a huge financial gain. Obvious things like, okay, the patients are better cared for, so you don't have negative outcomes, you don't have bounce backs, the left without being seen rate goes down. More importantly, the left before treatment complete rate goes down because your throughput is faster. So like I highlighted before, the provider in triage, a lot of people are doing that, but they're doing it in person. And that fixes your left without being seen because the provider sees the patient. But unless they're really doing a full workup and putting in all of the orders and the orders are getting completed, patients are still leaving before treatment complete. So we're seeing better metrics there. And then, of course, we're able to see patients quicker and more efficiently. So you actually get more revenue generation, which also helps the bottom dollar. And ultimately, right, we have to find a way to pay for any of the technology we're using. What eVisit does is simple software. It's a little bit of change management, which I am honored to get to be a part of. I'm happy to work with healthcare systems. If you're interested, we do a full assessment. We take a look at your emergency department and try to figure out exactly what the issues are and make sure we're solving the problem that exists and not solving for a problem that doesn't exist. But the bottom dollar is there, and we have found that our healthcare systems that implement it are able to be much more efficient and decrease their costs while increasing their revenue.